Hello, myself, Dr. Mohammad Abrar Guroo. I'm working as a senior psychiatrist at Government Medical College, Srinagar, as a assistant professor in Telemanas, which is a telepsychiatry branch of National Mental Health program. So today I will be deliberating on dementia. If we see the prevalence of dementia, so around 55 million people globally have been affected by dementia and they are suffering from it. Whereas if we see towards early signs of dementia, like for the families or the caregivers who are there in the family and they want to understand dementia early and they want to see that later on when their parents or their family members they grow along with their age, they don't suffer from dementia. So there are few signs or there are few symptoms which can be early picked by the caregiver and which can help in early intervention as well as treatment. So if we focus on those, usually we diagnose dementia after 65 years of age. But usually the symptoms can start before 60 years of age, which we can call early onset of dementia, as well as it can start after 65 years of age, as there is no specific thing or specific age at which it will start in a particular person. And also it depends on the various other factors, which are metabolic factors, health factors, it can be genetic factor, it can be environmental factor. So all these factors can make a person vulnerable for this dementia. So if we want to focus on the early detection and treatment part of this dementia for caregivers, it's very important to understand that if a person or their family member who is elderly, who is at home, they start to have memory impairments, because memory is the first and most important domain that gets impacted in dementia. So they should first try to see that if there are any memory gaps, they are able to recall whatever it has been in the past. They can retrieve the memory from the past events long back when they were children or in their young adolescent or adulthood. But recent events or recent episodes or recent contacts, they are unable to recall or retrieve. It takes very much effort for them to recall them, and it's very difficult for them to recall. And most of the times, they will try to skip those things, like in which recent recall is needed. Along with it, there is a cognitive dysfunction. By cognitive dysfunction, we can understand the things that help us to deal with our lives daily, like our working, like our functioning, living, doing things. So usually we can identify early dementia by seeing that if a patient is unable to do the familiar tasks, like the things he used to do previously, it wouldn't take him much time, it wouldn't take him much effort, he would do it seamlessly. But right now he's unable to understand the working of that task. It's getting difficult for him to do, or he's trying to avoid that task. Also, along with this, we need to understand that if he's not able to understand it, even if after we try to explain or we try to tell him that to do it in a particular way, still there are lacunae or there are mistakes in that. So that helps us to guide towards that there can be onset of dementia, or it can be as an early sign of dementia. With it, there can be praxis, like if the things, like if a patient is unable to do his daily chores, like he was able to wear his clothes, he was able to mend his clothes, he was able to attend to his things, mend his things. But right now he's not able to do those things. Like if he was putting on a shirt properly, he was putting a button and then untying it. Right now he's not able to do these simple tasks which are natural to a human being. While as also about his things, like he tends to say that he has misplaced or he has forgotten things somewhere else, or he has they have been taken by some people, and he usually forgets the name of the close ones, like family members, the friends with whom he is living or who are very near or close to him. So these are the few things that give us an early idea towards identifying a dementia, so that if a caregiver is there with an elderly person, he or she can identify that it is a difficult phase for a person and he or she needs attention for this dementia, because dementia is a progressive illness and it's a non-reversible. While as we can do interventions which help us to help this patient in tackling these symptoms, as well as they help in early recovery, and as well as they help to prevent progress of this dementia process. So, in that case, early intervention and identification is very important. Also, along with this, behavioral modifications that can be done on early stage. If the dementia progresses to a late stage, it's very difficult for clinician or a caregiver to administer behavioral theories or therapies, we can call particularly. While as if in early stages, we can easily help by changing the behavior as well as increasing the cognitive efficiency of this elderly patient. So my message to all out there is that early identification of dementia is very important, both in treatment plan as well as in improving the quality of life of these patients. With this, I thank you all. Thank you.